इसको जूम आउट का फंक्शन है क्या कुछ? लैटरल जॉइंट लाइन है.
इधर सरांची प्रूफ वगैरह काढले का? हेलो माइक चेक. हेलो माइक
So
चेक.
we are audible.
Are we audible right now? Are we audible?
Yes.
Okay. Okay. So good afternoon, everyone. Myself, Dr. Nikhil Bothra, and now we are going live for arthroscopy workshop, which is to be done by Dr. Akshay Marwar sir from Chhatrapati Sambhajinagar. Over to sir.
Yeah, I hope I am audible to all the audience sitting in the hall. So right now, so this is the right knee of the patient. We are doing arthroscopy of the knee. We are entered. Please show it here. Zoom in, please. Zoom in. We have entered from the lateral aspect. This is the anterior aspect of patella, where is my index finger is, and we have entered from the anterolateral aspect into the knee joint, and this is the medial aspect of the knee. This is the lateral aspect of the knee. After entering, so now what we are viewing, we will show the screen now. Over to screen. So this is, we are inside the knee joint. This is the medial compartment of the knee. This is the intercondylar notch. The shiny structure is the anterior cruciate ligament. Majority of audience sitting there is, I think, from second year MBBS. And this is the, sorry for that, but this is the intercondylar notch, and we are able to see anterior cruciate ligament. This is the top portion is femoral condyle, the below portion is tibial condyle, and the structure visible in the periphery and the right hand corner is the medial meniscus. So we will now go inside the medial compartment by triangulation. Needle, please.
अरे इकडे दाखवा.
So this is the medial entry point. So we are going with the light therapy. So we are inside the joint. Show the screen, please. Erika. Dilator, please, and artery forceps. Probe, please. Right. So my probe inside the knee joint now. So this is the intercondylar notch of the femur. This is the anterior cruciate ligament. I hope I am audible and the screen is visible nicely to all the audience. So this my tip of the probe is at the femoral condyle. This is the cartilage of the femoral condyle. This is the cartilage of the tibial condyle of the medial compartment, and this structure is the meniscus, medial meniscus. So this structure is the medial meniscus, and we are going to have the meniscal debridement in this surgery. So right now we are facing this synovial tissue. We will debride it off with a system known as shaver. Suction on, please. So this is my shaver coming inside, debriding out the synovial tissue which is coming in the view, and as well as the patellar fat. So we have to just take out whatever is tissue is coming in view, so that we should not be ending with removing the unnecessary tissue. So this surgery is done under a thigh tourniquet. Pro, please. So thigh tourniquet here, please show it here. This is the thigh tourniquet which is avoiding the blood flowing down, so that we can have the avascular field and the white field like this. So my probe is now into the medial compartment. This is the cartilage lesion we are facing here. This is the medial femoral condyle. This is the cartilage lesion. This is the medial meniscus. So backside that medial meniscus is having a small tear. We are viewing the medial compartment. This is the anterior cruciate ligament. It is bulky and shining. And this is the lateral compartment. So everything, the cartilage here is having severe degeneration that we call clinically is known as osteoarthritis. So we are going to deal with this cartilage lesion so that the lady will have relief in pain. This cartilage lesion we are going to debride. Scoop, please. Curate or scoop. So this is the instrument known as scoop. This is taking out the loose flakes of cartilage present on the cartilage defect on the medial femoral condyle. So you can see the exposed subchondral bone here, because cartilage is very loose, and the condition is known as osteochondral defect. The defect present on bone as well as the cartilage. So this is the reason why the lady is having severe pain in her medial compartment. So we are removing only the loose part of the cartilage. Everything is audible there? Please confirm. So this is the subchondral bone visible with a large osteochondral defect. In orthopedics, we call a grade 3. Our radiologist Bothra sir reports it as grade 3 osteochondral defect on the femoral condyle. So this spoon-like structure known as scoop or curate is removing all the defective cartilage on the medial femoral condyle. So with the shaver system, we have a suction available which sucks out all the loose pieces. This is all the loose pieces of cartilage coming out, getting sucked inside the shaver blade. These are all the loose pieces. Whichever is not removed with the suction, artery please. The loose pieces of cartilage we removed, which were not removed with the suction, we will remove it in artery forceps. This is a loose cartilage. So now the challenge is the lady is facing is this osteochondral defect. It is a large osteochondral defect present on the femoral condyle, medial femoral condyle, which is giving pain. So we are planning a micro fracture. That means we are doing multiple tiny holes inside the subchondral bone so that the marrow fluid and the marrow bleeding comes out and forms a layer of hyaline cartilage here, so that the pain of the lady will be temporarily reduced. So we'll go ahead with that procedure. All please. And a hammer. So this instrument, which is a curved and a pointed, is known as an awl. So we are going to have some holes inside the bone. Please. Yeah, please go. Please go. That's it. Okay. So this hole exposes the subchondral marrow. So we'll have multiple holes like this at equidistant sites. Hammer, please. Yeah. Okay. Right. Okay. Yeah. Please hammer. Gently. Yeah. Please go. Please go. So we have to go up to the neck of the instrument. Yeah, please go. Yeah, hammer, hammer. Go, 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 go. Yeah, that is the neck of the instrument going inside the subchondral bone, exposing the marrow of the medial femoral condyle, so that fresh bleeding comes out and heals the lesion by internal healing. Now, stop. So the space is not able, so we have some central hole here. Yeah, gently please. Yeah, go, 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 go. Bah. So that many microfractures will have the ooze of the marrow blood gushing out. Suction please. So that is the gush of blood we can have. Is it visible? We can see the gush of blood from the drilled holes. Yeah, it's visible now. So this blood and the marrow fluid combinedly forms a layer of hyaline cartilage here, so that this lesion known as osteochondral defect will heal by a secondary intention. Suction stop please. So this oozing of blood from here, we can see the ooze of blood from here, all the holes will have eventually the blood. See, it started here now. So this will form an hyaline layer of cartilage here, so that this lesion heals with an hyaline cartilage and the patient will have reduced pain of the osteoarthritis. So that's it for the demonstration purpose. If anything else needed, please let us know and we will go ahead with the final surgery, or otherwise we'll stop the recording. पूछो एक बार फोन करके. तो परंतु स्क्रीनच दाखव कृष्णा. Suction please.